Welcome to Live, Work, Thrive. I'm Makayla Birmingham, Scary Mommy executive producer, and I will be the moderator for tonight's panel. Tonight's episode is focused on what we know now about ADHD. As the third in our neurodiversity series, we will be discussing parenting children with ADHD, how to overcome challenges and strategies for helping your child thrive. Specifically, tonight's discussion will cover the traits of ADHD that can actually be superpowers for kids and adults, what parents of kids with ADHD wish others understood about their kids, how ADHD is diagnosed and underdiagnosed, and we will be taking lots of questions and comments from our live audience. Let's meet our panelists. We have with us tonight Dr. Maggie Sibley, researcher, psychologist, and author. Thank you for being with us tonight, Maggie.
Thank you for having me.
Dr. Maggie Sibley is an associate professor of psychiatry and behavioral sciences at the University of Washington School of Medicine and a clinical psychologist at Seattle's Children's Hospital. Her research on ADHD is funded by the National Institute of Mental Health and the Institute of Education Sciences. She's a member of the Professional Advisory Board of Children and Adults with Attention Deficit Hyperactivity Disorder, known as CHADD, and the author of Parent-Teen Therapy for Executive Function Deficits and ADHD. We're so lucky to have Dr. Sibley with us tonight. In addition, we have Rhashidah Perry-Jones, author, parent educator, and coach. Rhashidah, thank you for being with us tonight.
Thanks for having me.
Rhashidah is an award-winning writer and communications strategist. She's also a parent educator with a focus on providing strategies for family members raising children with ADHD. She is the founding coordinator of Philadelphia Children and Adults with Attention Deficit Hyperactivity Disorder, the Philly branch of CHADD, and was elected to the National Board of Directors and the Chapter Advisory Board of CHADD. CHADD is in the house tonight with you two. All right. So before we get started, we have a few reminders for the audience. You can submit your questions in the comments wherever you are watching, and we may feature your question later on in the show. So stick with us. You can also join our mailing list so you don't miss any of our upcoming virtual events. Visit scarymommy.com/liveworkthrive to sign up and stay in touch. So let's get into tonight's topic. Dr. Sibley, why don't you set a little background information for us here? Sometimes the terms ADD and ADHD are used interchangeably to describe children with attention difficulties. Can you explain how the two are the same and or different?
Yeah, so in the 1990s, there were two terms. One was ADD, and that was for kids who had inattention and focusing difficulties, but not necessarily the hyperactive component of this disorder. And then there was ADHD, and those kids had both the focusing difficulty and the hyperactivity. So eventually, the two terms were combined into just ADHD. So nowadays, the modern term is ADHD, and that refers to kids who have either inattention or hyperactivity or both. So even if they don't have hyperactivity, we still call it ADHD today.
That is a great explanation because I was always wondering that myself. Thank you. So Rhashidah, can you explain some of the key traits and symptoms that may signal to a parent that their child may have ADHD? And why, tell us, is it important for families to get an actual ADHD diagnosis?
Sure. So when you're looking at your child, parents, we all know our children. Oftentimes children can be very communicative. And some people say, talking incessantly, but I like to say communicative. Other times the children are very energetic. They like to run around a lot. And sometimes folks may say that they daydream. I like to say they're imaginative, but other folks may say daydreaming. So those are some of the things you can look out for. Also, if your child has difficulty following multiple kind of directions, go upstairs, open your drawer and take your clothes out and put them on the bed. And those things seem to be difficult and that they need to break them down into smaller parts. That can be another way. But the most important thing, as you had mentioned, is to get a diagnosis so that you'll know what you're dealing with. if you get a diagnosis, there's something called the DSM-5, where you can get a diagnosis to find out if your child actually has ADHD. You will know what you're dealing with, if they have ADHD, and if there are any comorbid or co-occurring conditions that some of those symptomatology is manifesting as well.
Okay, that's helpful. So, Dr. Sibley, when a parent is taking their child in for this assessment, does that involve both, cognitive testing or exercises with the medical professional, or is there also a blood test? I think you were speaking earlier when we spoke about some genetic components of the disorder.
Yeah, so usually the first point of contact to look into possible ADHD would be with your pediatrician. And their main way of diagnosing ADHD right now is by asking parents and teachers to figure out if they could report on any of the ADHD behaviors in the kids on rating scales. So questionnaires that would go home. And right now there's no blood test for ADHD. There is a genetic component to ADHD, but it's kind of complicated. There's not one gene that signals ADHD. And so we have to just look at behaviors and make a guess about whether or not somebody has the disorder based on the perspectives of everyone in the child's life.
Got it. And so when we're talking about diagnosing, Rhashidah, we know that certain communities are underdiagnosed, notably children of color, with girls being underdiagnosed more frequently than boys. How does systemic racism play into this whole situation here?
Oh, that's a very good question. A lot to unpack. Folks have generally thought that children with, particularly Black and brown children, have been overdiagnosed, but research shows that's not the case. In fact, Black and brown children are more likely not to be diagnosed with having ADHD. And then if you're a girl, that's even less likely that you'll be diagnosed with ADHD. So it's very important that if parents see any of the behaviors typical of ADHD, that they can speak to the teacher, speak to the school about getting a diagnosis, or speak to the pediatrician about getting a diagnosis. One of the things that we're concerned about is because in school, oftentimes, particularly Black children, tend to be, have are punished or have some corporal punishment more so than their white counterparts. Oftentimes that behavior may be punished when it's actually could be ADHD. So it's important to get a diagnosis. It's important to see with these types of racial disparities, how they play into how the school and how that teacher may look at your child.
So yes, this is something that, as parents, we see, I think, you start to really unpack how discipline works and how race factors into that equation. So Dr. Sibley, if we want to dismantle this, problem of underdiagnosis, clearly children of color are being underserved, is it a matter of changing the training of healthcare professionals? Do we need more diverse representation in the research side of things? How do you think we could begin to address this?
Well, I agree with what Rhashidah said. We really need to build awareness of what ADHD looks like and how the face of ADHD can be different in different kinds of kids, whether it's misattributing certain behaviors in schools to something other than ADHD by teachers, which we know from research happens all the time. Kids who are Black and brown are more likely to be considered to just be having an attitude, whereas a child who's white could have the same behaviors and be considered, oh, maybe they have ADHD. So we need teacher awareness of that. We also need professionals to be on the lookout for ADHD that isn't a typical presentation. Quiet kids with ADHD who aren't disruptive, kids who can be really good at school and still have ADHD. And so the more we can build awareness of ADHD isn't just a hyperactive, middle-class, 8-year-old boy, the more that providers can be on the lookout and parents can be on the lookout and everyone can be on the lookout for kids who are struggling and need help.
That's a great point. So, Rhashidah, tell us about what you know about the link between a parent and a child. Does it tend to be, passed down on occasion from mom or dad?
Yeah, there is evidence and research that suggests that ADHD can be inherited by a parent. And that can be challenging because oftentimes that parent may be undiagnosed and may not know that they have ADHD. And then they're trying to get supports for their child that has ADHD. So there is definitely a component that in research that suggests that it can be passed to, to your child.
So Dr. Sibley, like overall in the pediatric population, what is the percentage of children that have ADHD? Is there a number that we can estimate, or?
It's about 5 to 10%. And sometimes the higher estimates are kids who have ever been diagnosed with ADHD, and the lower are kids who currently have ADHD. And that just speaks to the fact that sometimes when the right supports and resources are in place, kids can overcome it. And so there are some kids who've been diagnosed with ADHD, but have gone back to the professionals and seem to be doing a little bit better now.
Oh, that's great. So, Rhashidah, we talked earlier about some of the Black celebrities who have been very open publicly about their own living with ADHD. Tell us about the impact of, when a person like Simone Biles or Nick Cannon, comes out and talks about this. What does that do for the, the conversation?
It helps the conversation. Oftentimes, Black and brown children see sometimes negative images of Black and brown people in the media, on television, and can often have, or feel like, their negative images, and these negative images make them, make them feel poorly about themselves. Actually, having folks like, Nick Cannon and Simone Biles coming out and saying, I have ADHD and I'm successful, lets these children know that they can be successful as well. As a parent raising a child that has ADHD, and a Black child particularly, we have to have so many more positive statements and encourage them, because they've been bombarded with a lot of negative images. So on top of that, with ADHD, having folks that you can point to and say, look how successful they are, they have ADHD. And what they've done is turn some of this energy and other things and being funny into, a strengths-based approach and making it work for them instead of making it work against them.
And so your daughter, who's now in college, did she have role models back when she was growing up? Were there celebrities or other role models out there in the public eye that you could say, wow, that person has a superpower just like you, or has it only now, in the more recent years, become something that people were comfortable speaking about publicly?
Right. Well, she's an adult now, and growing up, she didn't have a lot of, particularly, Black and brown folks that had said they had ADHD. But one of the things that was important was to get her around other children that had ADHD, so she could see that, she's not very much different. And there's a group of people that she can feel supported around and that are similar to her and have that same kind of effervescence that I like to say that she has. But it wasn't as common for someone to say so. And particularly in my community, it was difficult for other parents to say their children have ADHD or their child has ADHD. And sometimes you got some pushback from family members saying, oh, that's not ADHD. That's not a thing. That's not real. You just need to be more strict in parenting and other things like that. So, there's that, pushback you can get. And I'm glad that now people are seeing that, yes, this is a real thing. And there's a way that you can work with your child to make sure they can overcome some of the, challenges associated with it.
For sure. And speaking of challenges, we actually reached out to the Fatherly and Scary Mommy audiences and asked parents of children with ADHD to tell us, what they wished other people would know and understand about their kids. So for our Geico moment tonight, we are going to hear from the first parent, Barbara Luna. And she says, regarding her daughter's ADHD, she wishes people would give her a minute. She heard you. She's processing, she says. It's not disrespect. It's not defiance. It's processing. So Dr. Sibley, this is, I feel like a theme that we've heard from so many people in our comment section about how we just need to give these kids a beat, give them a minute to take it in. And they are, not disrespecting. They're not trying to be rebellious. They're just like, they need a little extra time. Is this processing component of the condition something that, you see often, and how can both parents of children and others work to support that element of the condition?
Yeah, it is. Not all children with ADHD have that processing component, but that's a component that a lot of them have. And it's true, it takes them a second to kind of switch gears, to hear what has been said, to react and respond to it. And so when you have a child like that, parents can learn strategies like giving warnings before they're going to ask for something, or they can ask them for something and then count to 10 before they repeat it, just to be sure that they are taking into account that a lot of times kids with ADHD are well-meaning. And it's really important that we don't jump on them prematurely because they already hear a lot of negative feedback in their environment. And we really want to limit that as much as we can.
That's a great suggestion. Count to 10 in between when you ask the question before repeating it, so you're not badgering this kid. My husband would probably say the same thing for me, just in general. So Rhashidah, often parents need an official diagnosis to access services and other programs for their child. Are there situations or circumstances when a parent may not want to disclose, publicly about their children's or child's ADHD diagnosis?
There could be. I tell parents that I work with that it is up to you what you do with that information, particularly if you get it done privately. If you get it done, the evaluation done through the school will know. But some parents, particularly, parents, African-American parents, are concerned that their child will be labeled if the school knows that they may be pointed out. They may be, impacted negatively by, the school knowing about that diagnosis. So I say to parents, it's up to you, and you need to feel comfortable about sharing that information. But if you do not share that information, and if your child needs, individualized education plans or 504 accommodations, you won't be able to do that. Now, if your child, is having challenges in school, that is best to share that information so that you can get the supports and that your child can get the supports that they actually need.
Great advice. So in terms of, getting support and necessary interventions, Dr. Sibley, tell us, how does a parent navigate, pharmaceuticals, non-pharmaceutical interventions? I feel like back in the day when I was a kid, it was like, give everybody the Ritalin. Everyone's too excited. Just give it all to the children. What is the current kind of standard now for, assessing, what is the best solution for a child?
We're so lucky that there are multiple solutions right now for kids, and that parents can choose the solution that feels most comfortable to them and that's in line with their values and what they care about. Specifically, pharmaceutical interventions like Ritalin, like Concerta, Adderall are some of the ones people have heard of, are effective treatments when it comes to helping kids focus and control their behavior, especially when they're asked to do things on task like long homework assignments. In addition, we have behavioral interventions that can be delivered by psychologists and therapists and also people in the schools that are also really effective at supporting kids to learn new skills, to master, self-control and be more on top of their behavior. And some families choose to do both of these treatments at the same time and try to give the maximum supports. Some families try one first and then try the other. And it really, there's no right way to do it. It's really up to the family and their provider to talk about and to make those choices, from a personal perspective.
And I just want to make the point that here on Live, Work, Thrive, we are not giving you medical advice to go out and self-diagnose or, experiment. That is a conversation to be had with your medical provider, because there is no one size fits all solution, as Dr. Sibley just described. So I think you've mentioned the term effervescence, Rhashidah, and, ways of taking on a strength mindset when you're thinking about some of the ways that a child with ADHD moves through the world. And they're not always the same as a neurotypical child, but in some situations, they can almost be seen as superpowers. And so we're going to take a look at a quick video that describes this perspective, and then we'll talk about it. Let's take a look.
This is Mindy. She loves her puppy and unicorn backpack and wants to be a doctor when she grows up. Mindy also has ADHD, so sometimes she has trouble staying on task. She doesn't like to sit still, and sometimes it seems like she just isn't listening. For some people, Mindy's behavior is a problem to be solved, but that's not a very productive way to think about her ADHD. Think instead of Mindy as a superhero with a secret identity. Sometimes her superpower can be destructive and hard for her to control, but all that superhero strength, bigness, and wildness can also be a tool for good. As a superhero, she can stop a speeding train, shelter people from harm, and face danger fearlessly. Mindy's ADHD is like that superpower. It has its own advantages. If she's interested in something, she can hyperfocus, taking in knowledge without distraction. Mindy's thoughts don't go from A to B, which makes her creative. And she has a ton of energy, helping her excel at sports. But she'll thrive even more with a team, a superhero crew of advocates, professionals, and loving family members who can help her use her gifts for good, and maybe even save the world.
So, Rhashidah, tell us a bit about some of the ADHD traits that you've seen, maybe in your own daughter or in families that you've worked with, that kids can leverage for good and actually use as a superpower.
Well, one of the things, one of the traits and one of the manifestations, as I like to say also, the whole being laser focused or hyper focused. If you have a child that has ADHD, or a child that has ADHD, you might have been able to see that when they are interested in something, they are very interested and they can hyper focus. And using that hyper focus to your advantage is something that's important. That's something that I tell parents all the time. See what your child is interested in. See if they're using that hyper focus, and let them use that to their best ability and to help them. The other thing is multitasking. They can sometimes have the ability to do more than one thing. And actually, that may be more helpful for them so they won't be bored. The other thing is that energy. A lot of children with ADHD are pretty energetic, and use that to your advantage. You may be able to do a bit more than someone else may be able to do. Also, oftentimes children with ADHD are very empathetic and very compassionate. They could be very great with, working and volunteering with animals and working with children because of that empathy. And also very, very creative. Use that creativity, hone in on that creativity to the best of their ability. They're thinking outside of the box because they're not neurotypical. So encourage them to think outside the box and not necessarily do something like the other person or the other student is doing, and letting them know that their differences can be a strength, can be a superpower, and really, really giving them opportunities to build and to hone in on those strengths.
So, Dr. Sibley, this idea that some of these manifestations, as Rhashidah calls it, that's a great way to describe it, they can be seen as superpowers. It's a very, empowering idea. Is there scientific research to show or suggest that this is true?
I'm going to tell you all what the research says on this. And I think it's really important to think about ADHD is a trait that's on a continuum. So some people have it really severely and other people have it more mildly. And even people without ADHD sometimes have ADHD-like tendencies. And when we have a milder form of ADHD, we sometimes can see some positive benefits of that. For example, someone who's a little impulsive could be spontaneous and fun, but someone who's really impulsive can get themselves into dangerous situations or do risky things or even be kind of intrusive. And so one of the things that we see is that as people learn to overcome their ADHD and bring it into a more mild form of the disorder, the research does suggest that there can be some positive aspects of that. Like creativity is one that has the most research backing. However, it's also important to see the other side of that coin, which is that if we don't help people learn the skills to manage and cope with their symptoms, they won't get to turn down the volume of those symptoms and get to the place where there maybe can be some benefits. So I think it's really important to take a strength-based approach with ADHD. That's the approach I take. And I also think it's important to see that strengths can be related to ADHD, and also people have strengths not related to their ADHD. And those can also be leveraged to help them succeed and get their ADHD under control. And, I think parents shouldn't be discouraged if they're not seeing any of those positive aspects right now, especially in younger kids. A lot of times, I don't know if this is consistent with Rhashidah's experiences, but sometimes they start to come out a little bit more as the individuals get older and, start to become their own person and really start to find their interests.
So Rhashidah, is that, is that something that you've seen? I feel like, while as much as we want to lean into this strength-based approach and we want to embrace the kids who think differently, as a parent, it can be very challenging, especially if you are parenting multiple kids, right, at a time, and one may need more attention in different scenarios than your other children. How do you, in your work with families, how do you support parents who may be struggling to, recognize this strength-based approach when, like, on a day-to-day basis, it can be very challenging?
Well, it's important for parents to understand the challenges, educate themselves about ADHD, know what ADHD is, talk to professionals, and make sure you have a care team around your child to support you. I mean, you need support. Organizations like CHAD have parent support groups monthly, so you can exchange information and also talk to other parents that are going through the same thing. Get a family coach who can work with you and work with your family, which that's also a support system. You can have a psychologist and a psychiatrist, a child development specialist, a neurologist. Just make sure that you have a team of individuals that are professional, that are helping you with your child. And I think that type of support can help you deal with the challenges, because there will be some challenges. I mean, for me and some of the parents that I've dealt with, we've seen, some of these behaviors, early as 3 years old, 5, 6. And you notice, your child, some people say they're bossy, but, you see it as this person is definitely, has leadership qualities. But it can be challenging, and you have to look at it in a way to reframe it yourself. And in your reframing it, you allow those that are around you, particularly teachers, counselors in school, to also reframe it, to not look at your child as being somebody that's just bossy, but look at that child as being a leader. And if you're a parent and you're raising a child that is Black or brown, those tendencies to look at those behaviors more negatively, it's even more important for you to reframe those for the people that deal with your child, so they can see them as you do, and for you to have a support system so that you can be reinforced when things get kind of tough for you.
So Dr. Sibley, I mean, you're both of you have worked with and continue to work with the organization CHAD. And just hearing what Rhashidah said, different doctors, different psychiatrists, psychologists, it sounds like a lot to navigate, especially if you're a parent at the beginning of a new diagnosis. Does an organization like CHAD help parents navigate, how to find the best care, and kind of match support services with the needs of their family?
One of the really important things is for families of kids with ADHD to get good information, because on the internet, there's a lot of bad information about ADHD. And the great thing about going to a reputable organization like CHAD is that that information has been vetted and is correct. So they are partnering with the CDC, for example, to make sure that they get good resources out there to family. And that's the first step, and the most important steps for families is empowering themselves with correct information. And yes, there are a lot of resources through CHAD for connecting with professionals in your local area and other support groups like what Rhashidah was talking about, which is a big important part of the picture. But also it's important for folks not to get overwhelmed. One step at a time. You can start somewhere somewhere and build on that when you're feeling, comfortable and empowered with the first steps that you're taking. And ultimately know, 5 to 10% of kids have ADHD. There's a lot of parents like you out there who are going through similar things. And the most powerful thing you can do is to connect with them.
And Rhashidah, you lead a lot of parent work and workshops. Is Facebook a place that a parent could go to try and connect with other people, parents in their local geography?
Yes, Chad has a Facebook page. In Philadelphia, Chad has a Facebook page. Lots of the local chapters of Chad have a Facebook page. But I think what Dr. Sibley said about making sure that you get the correct information, that goes for Facebook as well. I mean, there are different groups on Facebook that are for ADHD, talk about ADHD, but you want to make sure that you connect with a group that is actually giving you information that has been researched, that has been vetted. So, look to Chad and organizations like Chad, the National Resource Center, to get this information. But there are groups on Facebook, and Chad has a group on Facebook where you can get information. And particularly going to chad.org, there are so many resources that a parent, himself, herself, can access, by going to chad.org. I, for one, that's how I became educated about ADHD. I mean, I really didn't know, what to do. And I attended something called parent-to-parent training, my husband and I, and that's when we started learning, using, incentives and token systems, because kids with ADHD often need rewards more immediately than other children. So how do we, how do we make that work in our house? And how do we carry that over to school? So just can't stress enough getting that accurate information with evidence-based research and programs and activities that have proven and that have been vetted to work to help you manage, your household and help your child. And the most important thing is to help your child start to learn how to manage their own ADHD and their own symptoms.
That is an excellent point. Just because the Facebook group says ADHD in the title does not mean they are coming to you with vetted, expert-driven information. Lord knows we live in the era of fake news. So everybody just go to chad.org and skip over all the other less desirable resources on the internet. I love that you made that point. Okay, so we're going to take another comment from our audience. Again, this is all about the theme, hearing from parents about what they wish others knew or understood about their kids. This comment is from Carrie Michelle, 816. She wishes others would understand that his bad behavior doesn't mean he's bad. He's struggling. Instead of focusing on correcting the behavior, let's focus on connecting with the need. Dr. Sibley, can you speak to this idea of, not scolding or reprimanding kids for behaviors associated with ADHD, but instead trying to figure out how to support them in a way that's actually positive?
Yes, it's really important for kids with ADHD to be getting just as much positive feedback, probably twice as much positive feedback as they are getting negative feedback, because naturally they're going to make more mistakes and they're going to say things that make their peers make fun of them or sometimes criticize them. And they're going to get more negative feedback from their teachers and even their parents, on your not best days as they walk through life. And so we need to work hard to make sure that they are getting those positive messages, because people with ADHD on average do have lower self-esteem than people without ADHD. And a lot of that starts in childhood with a lot of those negative messages. So parents out there of younger kids, you guys are in the driver's seat now. You still have the power to protect your kids from that by just making sure that they're surrounded by people who see the good in them. And I think it's important for people to work with their schools, especially to analyze what the issues are and to set sort of positive programs where kids have forward focused goals and can be rewarded for when they take positive steps in the right direction, instead of kind of a punishment based approach, where kids are made to feel bad or ashamed of who they are.
That's such a great point. And, for anyone out there who's watching, who's not a parent of a child with ADHD, but is a parent of a child who may go to school with another child that is, somewhere on the spectrum of neurodiversity, Rhashidah, do you have any language tips or suggestions of how all the parents can talk to their kids about being an ally and supporting, kids who might behave a little bit differently? Sometimes, your kid might come home and be like, well, Johnny doesn't listen. He's always acting up in class, Mom. I don't want to sit next to him or whatever. How do you reframe that as a parent to, a young child who maybe doesn't understand the larger context?
That's a good question. Oftentimes you can make an analogy to a day when your child, who is neurotypical may not have had a great day. And they might have had, difficulty, getting through that day. Maybe they were upset or something, and they might have, not wanted to engage with folks, or they might have just been in a lousy mood. And people might have, shunned them. And how did that make you feel when people, shunned you or didn't want to talk to you or didn't want to be around you? Like, how did that make you feel? Or how do you think this other child feels, knowing that you, don't want to be around them? So kind of putting the shoe, what is that old saying? The shoe on the other foot or something like that, trying to get them to empathize with that child and understanding that they may be experiencing some challenges that we know nothing about. And what we need to do is all of us are connected, and to show that child and to show your friend, that empathy and that extra care, because they may be dealing with something that day, like you were that time, that can be troublesome, that can be difficult. And you want them to afford that same kind of empathy and compassion that you will want afforded to you.
That's a great suggestion. And I think once kids do start to think that way, they can be so kind and protective of their, of their schoolmates and their friends. Once they, just kind of look at the situation from a different perspective, hopefully, in most cases. So let's take one more comment from our audience. Kelly Griffith 15 wishes people would know about her son, that he's not annoying because he talks so much. He's really just very excited and wants to connect. So Dr. Sibley, tell us about this trait of being very talkative. Is this something that, how do you manage that as a parent or as an educator? Do you let the child, get it all out, or do you try and, steer them towards, moments when it's appropriate versus not?
Yeah, I think you're onto something with that last one. So we want kids to have an ability to express themselves in appropriate forums. So if you have a kid who's talkative, you could be thinking about, when is an appropriate time for them to engage in a talkative way with others, but also helping your child understand the times when being talkative could get them into trouble, and thinking a little bit about teaching them how to kind of become more self-aware. And you can even set positive goals for that too. In the classroom, if they can get through a 15-minute period without bothering one of their neighbors about something, then there could be something like a reward for them for that. And so it's forward focused, it's positive, and focused on, trying to take steps to improve instead of punishing kids for, talking too much to their classmates.
Okay, that makes sense. And on the topic of school, one of the reoccurring themes we have heard in every one of the sessions that we've done on this topic of neurodiversity is parents struggling, advocating for resources for their child, whether it's autism or ADHD, in a learning environment that primarily caters to neurotypical children. So Rhashidah, what would be the biggest piece of advice you can offer to parents in this struggle where they just need to get, the loud bell turned down in the school, or, whatever the, the struggle is that seems, in their mind to be a modest ask, or, maybe it's trying to access, a special service. How does a parent begin to navigate the system when it seems like all the doors are being slammed in their face?
Well, if they have a diagnosis and evaluation, to share that information with the school, and to work with the school to create an IEP, or individualized education program, and to put goals in that IEP, and to put different types of accommodations into that IEP. This is something that is required by law, and that the school has to follow that. So if you are having difficulty with the school, you make sure that you either get the 504 accommodations, or you structure an IEP plan to make sure that your children or your child can succeed in school. But the top thing, get an IEP.
So the IEP, just to reiterate, you're saying is required by law. And if you have goals stated in this IEP and they're not met over whatever the time frame is, what is the recourse that a parent could take?
Well, a couple of things. I mean, if the school isn't doing what they're supposed to be doing, I mean, I know of several parents who have actually, sued school districts to make sure that their child gets they get the proper attention that they need. So that's something that a parent can do. Also, stay on top of that IEP. Oftentimes, parents go into these meetings, and because someone has all of these different letters, no offense, Dr. Sibley, but all these letters behind their names, they can feel pretty intimidated. It's important that you get the IEP, that you talk to the professionals, that you also become educated yourself, and you become your child's, advocate at all times. And don't wait until that next year to look at the IEP again. Have regular meetings. If you want to check in, when you first put the IEP together, if you want to check in, maybe 4 weeks later to see how things are going, check in 4 weeks later so you can identify if they're doing the job they're supposed to be doing or if they're not, and you can make interventions right then.
Do not underestimate a mom with Google Calendar alerts to follow up on the things, okay? So we are putting those IEP goals in our books, and we are putting alerts, and we are following up, and we are making sure that people are doing what they're supposed to be doing. Okay, I like this advice. So we have a ton of questions coming in from the audience. I'm gonna hit both of you with a few of those questions now. So Dr. Sibley, you can take this one. What are the long-term effects of taking ADHD meds?
So there's research on this in a few areas. One of them has to do with growth. So there's some evidence suggests that if kids take ADHD medications for a long time, there's a slight impact on how tall that they'll be as an adult. We're talking about, I don't know, maybe a centimeter or two. So this isn't a big difference. However, you can think about where it comes from and it makes sense. When kids take ADHD medications, one of the common side effects is appetite suppression, which means they're not eating as much and not getting as much nutrients. And so that can translate into not being as tall later on. Sometimes people worry that if you take ADHD medications throughout childhood, that your child might be more likely to be open to taking drugs when they're older. And I just want to reassure people that there's no evidence for that. There's no concern that taking ADHD medications as a child is going to make your child more used to or open to using substances. One thing that can happen is that if people take ADHD medications for a long time, sometimes they seem to get a little less effective over time. That is normal because you can think about other things in our life. People who drink lots of coffee, it doesn't affect them as much, right? Because they drink so much. So it's something kind of similar to that. So there are people out there and professionals out there who may advocate for things like taking a break for a little while to recover from some of these possible effects, and then maybe going back on, at a time you need to. And that's something you can talk to your doctor about, but we don't have any evidence of any serious long-term effects that anyone really needs to be worried about related to these medications.
That's good information. Okay, so Rhashidah, another question from the audience. Is anxiety a common trait for children with ADHD, or is it something that manifests if they don't have the right supports?
I'm not a doctor, but from my understanding with ADHD, it's not necessarily a trait or a symptom. There may be a comorbid or a co-occurring condition that is, rearing itself. That's why it's important to get a diagnosis. For instance, I work with parents who, their child may have ADHD and they may also have ODD. And they may have some semblance of anxiety disorder. So you have to look to see, you have to get that diagnosis to see what you're dealing with. But from my understanding, and Dr. Sibley, you can answer this from your background, It's not necessarily an outgrowth or a symptom of ADHD, the way that impulsivity may be.
I agree. And I think anxiety plus ADHD can be a blessing and a curse. So for one, it's two different difficulties to be dealing with at the same time. And at the same time, interestingly enough, sometimes anxiety puts the brakes on ADHD a little bit for people. And so people with ADHD plus anxiety tend to respond better to treatment and behavioral treatment sometimes. So certainly it's something that co-occurs pretty commonly. And Rhashidah's right. They're not related per se, but they just happen to sometimes both occur.
Okay. So Dr. Sibley, this is a question that we hear a lot. How do you know the difference between a little kid being rambunctious, lots of energy, versus ADHD?
The main thing that you're looking for is that the behaviors are causing a meaningful difficulty for the person in their life. So if you think about it, if you're slightly hyper, it's not a problem unless you're intruding on others, right? Or stopping yourself from getting your work done. If you're a little bit spacey, it's not a problem unless it's causing your school grades to go down, or it's causing you to miss important information, or it's causing you to not do your chores. So really what parents should be looking at is whether or not the tendencies that they're noticing in their child is actually causing meaningful difficulties and problems for them in their life.
Got it. Okay. So another question here, Rhashidah, what overlaps do you see in ADHD and high functioning autism? Rhashidah, I'm not sure if you can speak to this dual condition, but how do you recommend a parent go about helping their child who might fall into the area of overlap?
And I don't know too much about autism, so I am not sure. I think let's go to Dr. Sibley with that. But I would always say to, speak to a psychiatrist, psychologist, get professional advice.
And I agree. You need to go find someone who knows how to work with both of those disorders and not just one or the other, because it's not just ADHD plus autism. It's kind of like the whole is greater than the sum of the parts, right? So you're going to want to work with someone who can really understand your child and understand how most children with autism may have features of ADHD, but it doesn't always mean that they do. And not all kids with ADHD, have some of those autistic traits either. So you really have to find someone who can help you with that middle ground.
Got it. Okay. Rhashidah, lots of people are buzzing now about the IEP conversation. Can a child with ADHD get suspended while on an IEP?
That is, it can happen. Depending upon the IEP, you can have recourse. For instance, schools could do lots of different things. The question is, can you come back, or do you have a recourse for what they've done? If there is a behavior that is supposed to be worked on, or a goal in school that is in the IEP and it's not being worked on, and your child is suspended because of that, then you have a bit more of a recourse, because the school is supposed to be a partner in making sure that your child is successful at that school. So I would say that if that child is suspended because of something, a manifestation of ADHD behavior that was not really safety oriented, that you should fight that suspension.
You heard it here first. Rhashidah says, fight it. All right. So speaking of fighting, Dr. Sibley, how do I help them best with their emotion regulation and impulse control?
Well, I'm taking a deep breath when I answer that question, because it's basically a long road to do that. And I want people to know that, but it can be done. So there's no quick fix for kids who are having trouble controlling their emotions, but it's going to be an approach that has to do with teaching them skills that they can learn to help calm themselves down, and you as a parent knowing strategies that can make the situation better. And so I would say, if you're having a child who is struggling with the emotional symptoms of ADHD, the best thing you can do is work with a psychologist, because that's one piece of ADHD that the medications don't help with as much, but the psychology side of it really can help with it. And there's a lot of great programs out there, and it is a long road, but as kids get older, those who have the right tools in their hand and the parents who've been doing the right things will see improvement over time.
That's good to know that that is not an area that the medications will address. I didn't know that.
And just from, experience with other parents and my own experience, behavior modification therapy was very, very helpful in helping with impulse control. Also setting incentives. And some people call it bribery. I don't call it bribery. I think it's incentives. We had a token system where, my daughter was able to earn tokens for specific behaviors. It's important not to try to change a whole bunch of behaviors at once, but to focus on one behavior. And if you want your child to maybe wait before they begin, eating that cereal, or just going to get the cereal and all the cereal falling out the box, when you see them doing the behavior that you want them to see, be very, very descriptive in your praise of them doing it, saying, John, I see that, you really wanted that cereal, but you waited for 5 minutes before, until I came downstairs to get it. And I really, really appreciate that. So that type of descriptive praise, some other type of incentive, allowing them to earn tokens that they can turn in maybe at the end of the week. And maybe they'll have, can invite a friend over, or whatever that that your child, really likes to do, using those things to help elicit the type of behavior that you want to see.
That makes a lot of sense. So Dr. Sibley, another question for you. This parent asks, how can I get support as a parent when I have ADHD also?
Good question. And like we mentioned earlier, ADHD runs in families. And a lot of times parents first realize that they have ADHD when their child gets diagnosed and they recognize some similarities. And just like for children, there are two primary forms of therapy for ADHD for adults. And one of them is medication, and the other is cognitive behavioral therapy, a type of therapy you can get from a psychologist. So I say to people, I think it's really good for you and your child to be going through treatment at the same time, because you'll be learning things from each other. And one thing that's important to know is that structure is a really big part of implementing behavioral treatment, like Rhashidah's talking about with your child. And so sometimes just going to the parenting groups and learning those strategies, you can apply them to your own life, and that's great. And sometimes parents decide that they want to pursue additional treatment like medication, or like working one-on-one with a therapist to help support their parenting and their efforts that they're doing with their kid. And that's great as well.
Okay. So yes, like as you said, you might be learning about this at the same time as your child's diagnosed. So a lot of appointments in your future, but it feels like you're going to be better off by, addressing it for yourself and for your child right away. So Rhashidah, this is an interesting question. Can you suggest ways to talk to your child with a new ADHD diagnosis to understand the condition and also why medication might be needed? At what age do you begin to, talk to your child specifically about them having this superpower?
Well, there are a lot of things that can be considered with that when you talk to your child. Depending upon the relationship that you already have with your child. If you have a relationship with your child that you regularly talk to them, you have family meetings, and you have consistent communication, then, talking to your child about, a diagnosis with ADHD is something that would be, something more natural. It really depends on how old your child is. I mean, if you're talking to a 5-year-old, it may be a bit difficult to explain that. And you can explain it in ways of basically, getting there are books that help you. You can say to your child, listen, we went to the doctor. You explain to them that, we have noticed, and you notice that there are different that you may be a little bit different than other children, and that it's fine, that we love you, and that there may be some things that you may need to do or that may be a bit more difficult for you than other children. And we are here to support you and work with you and do whatever needs to happen to make sure that you're successful. So there are some books, and I can't remember them right now, that help you through these conversations. Chad has resources that help you through these conversations, but it all is based on the type of relationship that you already have with your child and your comfortability with, explaining and talking to them, and also how you think that they will respond to it.
Okay, that's good advice. And now this is a really good point. We've heard about, there are specialized schools. There are all sorts of, therapists and psychologists and psychiatrists that you can, potentially connect with depending on your child's needs. How can a parent pay for all of this stuff? If treatments and sessions are not covered on if you do have health insurance, are there options that are low cost or free that parents can access? Dr. Sibley, do you have any advice here?
The public school system is probably your number one first resource in terms of getting your child interventions that would be hopefully low cost to you. Just like Rhashidah was saying, if you get an IEP, then there is entitlement there, both to accommodations and hopefully also to services that can help your child. Also, most folks are going to have some sort of mental health coverage if they have health insurance. There's mental health coverage with Medicaid plans, private insurance plans. Of course, it ranges, but hopefully you're able to get reimbursement for medication as well as some mental health therapy services. So there are ways to get good treatment for ADHD without breaking the bank. That is definitely true. And at the same time, people who want to put money into this and can afford to, of course, they are going to be accessing, additional specialized services for their kids. And I think this speaks to a need for our, society and our public systems to be investing in care for kids with ADHD, because we know if they get it early, it will make a difference. And we want to make sure that it's not just people with more resources who are getting the most help.
That is a great point. Okay, so Rhashidah, you're going to get the last question here in our forum. On the anxiety side, is it better to push them past their comfort zones with new experiences or allow them to opt out if they're uncomfortable?
Well, when in working with parents and in working with my daughter who also has anxiety, it's good to work with a professional, but if you know your child, you give them the other option. You ask them, what are they feeling anxious about? And, if the anxiety is because, they don't think they're smart, all these things true. These things are not true. You show them and talk to them about the things that we know, because anxiety is something where, folks are looking, ahead, and they're not necessarily in the present moment. So doing practices like meditation that helps them, stay in the present, and also these things that they're anxious about, looking at them to see if they're true or not. And generally, they're not true. Generally, there are things that they are projecting onto themselves or projecting onto something else, and having, this conversation, bringing them into the present to show them that these things that they're anxious about really are things that not true. And you can stop yourself when you see yourself going down that road. Stop yourself from going down that road. I see that I'm starting to have a trigger, or I see that I'm starting to have a thought that isn't necessarily true, or I'm becoming anxious. I can make the choice to think that this experience is going to be a great experience. If I make the choice to think that it's going to be a horrible experience, it's more likely to go that way. But I have the ability to choose how I'm going to think about this, and letting them know that they have that power to control how they're going to look at something and how they're going to choose to think about it.
That is great advice. So we are almost out of time. Keep talking in the comment section. I know we've been getting a lot of questions and comments, so we thank everyone out there who's watching. This live event will be up online. You can watch it at a later time if you missed the beginning or whatever. Feel free to tune in for the full Live, Work, Thrive episode wherever you have found this show. So I want to also let you know before we wrap up that our next live event will be on October 12th, and the topic is the 360 declutter, closet, kitchen, and community. Join us as we discuss what the pandemic has taught us about how we live, how we accumulate stuff, and how to know when it's time to cut out toxic relationships. It's going to get spicy, so don't miss it. Register at scarymommy.com/live-work-thrive. So thank you to both of our incredible panelists, Dr. Maggie Sibley, researcher, psychologist, and author, Rhashidah Perry-Jones, author, parent, educator, and coach. This was such an informative session, and I hope all of you out there found what these two experts had to say useful. And we will have, as I said, the full 1 hour episode up on scarymommy.com for you to really dive into some of the details. And it sounds like chad.org is the place to go if anyone's looking for kind of like a starting point for resources. Would that be fair to say from our experts? Yes? Okay. Sounds like a plan. So everyone check out chad.org. First stop, got to be there. Watch out for the phony Facebook groups. Make sure you know who you're joining. This is a good, excellent tip. So have a great night, everyone out there watching. Let's embrace what makes our kids unique, especially when they learn and process the world differently than most. ADHD, as we've learned tonight, can be a child's superpower if we let them own it and support them to live, work, and thrive. Good night, everyone.